everybody, I'm Katie, and we're at Inked and Linked with Jess and Angie. Hi.
Hi. Hi. I'm Jess. I am a tiny tattoo artist and also paramedical tattoo artist. And
I'm Angie Herdman, and I am a permanent makeup tattoo artist and also a paramedical artist as well.
So what do you do at Inked and Linked?
So we have a lot of services here. We have the permanent jewelry, the fine line tattoos with Jess, permanent makeup, paramedical tattooing, which can be like scarring, stretch mark camouflage, and then a 3D areola. And then we also have a satellite location for a med spa in the back that does Botox and fillers. So,
Okay, cool. As somebody who's gone through breast cancer, what kind of services specifically for somebody who's gone through this kind of treatment and maybe has had a bilateral mastectomy, and even chemo? So this service would be perfect for making us feel a little bit more like ourselves again.
yeah, so with that, we can provide a lifelike 3D areola tattoo on you, and it is extremely realistic, and it makes you feel so much better looking in the mirror, and it's back. It just brings back that confidence of maybe some people might not have them there for such a long time, so finally getting that back just boosts up that morale and just makes you feel so much better, makes you feel whole again. And then Angie, she can do also the paramedical tattooing, but also eyebrows.
yeah, so I mean, as you know, with chemo, you can lose hair, and sometimes it doesn't always come back. So we can go in, and the insurance will cover it. We can go and put your eyebrows back on for you, which can give you some self confidence back as well too.
I definitely lost most of my eyebrows, and thankfully they've grown back some, but this is definitely penciled in a little bit because it's such a weird experience and you don't look like yourself. You have no idea how important your eyebrows are until they're gone.
Yeah, they're really face framing. And also things like scarring, we can work on scars too, depending on if you do get your implants put in or whatever, we can work on your scars, whether they're this way. And sometimes they do fat transfers where the scars can be down here. Sometimes they transfer we talked about that, right, in the back. So anywhere you have scars, we can also work on as well.
Yeah, because one of the places that you don't expect to have, especially after a mastectomy, are those where you get the drains. There's like these little dots that are like this big, and you have these like what's happening here, and they're just like these little places like that.
Yeah.
That I don't think people think about afterwards.
Right. And I had a client that, for whatever reason, they flapped her this way, so she won't wear anything that's like low cut. So we went in and we camouflaged because it was white. It was real white, and then her skin color, and we just camouflaged and made it match her skin color.
That's amazing.
Yeah. So now she's like, I can wear t-shirts again that are, not low, but she can show some skin.
And I know the areola tattoos are super specialized because of the ink involved. Like, how do you get the ink? Like, where do you source it? Like, how does that all come together? Because it's like you said, it's so realistic.
So we use a mixture of different inks. A lot of times we'll match it up with the color of your lips, or if they have a picture of what their nipples used to look like, which is really beneficial, then we can match it up with that. But for me personally, I use probably 6 different colors of ink when I'm going in and doing the areolas, and every little different spot has, its own specific color. And then, you just keep on coloring over it until you get the right one. And then if it does fade, or if they, want something darker or something like that, we can always go back. But yeah, there's just a lot of different colors to choose from. So I like to use as many as possible to get it looking really realistic. I don't know if you want to talk about any of the
Yeah, because it's not just some random pink or beige.
No. And you can't use the same color for the whole entire thing. You have to make it look like 3D, so you have to have shadows, and you have to have different colors that cause that shadow to look realistic.
And especially I feel like the people of color, and trying to color match something like that versus So you have to have those wide ranges.
Definitely.
Can you explain the insurance process if somebody's interested in doing this? Is this like, how big of a pain is this?
So, I mean, everybody knows insurance is kind of a pain. So, we have a medical biller that works with us. So she pretty much takes everything off of our plate and also the patient's plate as well. So basically, it's very simple. I just send you a link, you fill out the stuff online, and then she takes care of everything else. She contacts the doctor, the office, she gets all of your paperwork, and then she tells us when we can book you. And it can be a couple months, weeks, just depends on the insurance. We can take all of insurances. However, it just depends on the insurance company, how quick the turnaround is going to be. So like sometimes it can be a couple weeks, sometimes it can be a couple months.
So the process of getting this done, it's about the same amount of healing time as a regular tattoo?
Yeah. So the first session, you would have to be 6 months post like everything, surgery, healed up, everything. And then we would go in, we can do the first tattoo, and then 6 weeks after that we can go. And we do suggest a touch-up. You may not need, and I've had people come back that didn't need anything, maybe minor little adjustments, but yeah. Same as like the fine lines and the brows too. Like the brows, same time frame.
So what's the difference between somebody maybe going to a regular, a tattoo studio versus like getting something like this done here?
So here we offer private rooms. They do lock. We do lock the front door as well. It's very, very private, clean environment. And we take pride in that, making sure that you're comfortable, making sure that you feel safe here in this environment. And yeah, it's just a nice private time. So
yeah, I feel like we've gotten a lot of feedback from like patients that are in hospitals versus here because they feel like that's so sterile.
Yeah. That
like, and it's good that it's sterile, but this makes them feel like wholesome again, that they're like, oh, like this is for me. So they like that it's like, a private studio that's just doing things for them.
It's like a pampering for yourself, because we so much, the lacking of self-care, especially afterwards when you're already feeling so not, you're not you anymore. You're a whole different person. And now you can come in here and kind of like, oh, wait.
Yeah.
Okay, so you're inked and linked. What is the linked part?
So the linked is permanent jewelry. I'm not sure if anybody's familiar with it, but basically it's just jewelry that it's claspless, so there's no clasp on it. Both Jess and I have it all on, and it's, you can make it in anything. I've had mine on. It'll be 4 years in September. And, I know a lot of people that get surgeries done ask the question, like, what happens if I'm getting an MRI done? With the MRI, it just depends on the doctor and the person doing it, or also how like strong the magnet is. But typically you don't need to take it off. And if you do, you can just cut it with nail clippers and we'll put it right back on for you for free. It's like something that we do, like we fix for free for life. And you can also like customize it. So like Jess has on like a lot of like on this arm, like her kids' birthstones and then her kids' initials. Like we have a lot of like really great, initials and custom charms that you can turn into yourself. So
I love that.
Yeah. And the inked is the fine line tattoos and obviously all the tattooing.
So you can come in, feel a little bit more whole, and pick up something really pretty to celebrate yourself.
Yep.
Oh, I love that.
Yeah.
So where can we find you on social media?
So we're on Instagram at Inked and Linked, and then Jess has Inked and Linked Jess Corey. We also have a website, www.inkedandlinked.com. Facebook, same thing, Inked and Linked. That's it.
How easy is it to make an appointment with you?
People just send us a DM, but you can also click the link in our bio and book it that way. So with us, we are appointment-based only. That's not a me thing, that's a borough thing, so we can't technically have hours. So that's another like nice thing. There's not that many people in here all the time. You're usually in here like one-on-one. You can just click the link in the bio, and then if there's any issues with the booking, like we pretty much send you a DM right away or a text.
Well, thank you both so much for talking to me about this. I'm so excited to share this with our Thrivers.
Yes, thank you.
Thank you for coming, and thank you for having us.
Oh my gosh.